Across the world, more than 1 in 5 adults live with persistent pain. And pain itself isn't always harmful. It's the body's signal system drawing attention to stress, strain, irritation, or healing. It helps us protect, adapt, and recover. But many people notice a particular pattern. Pain that feels manageable during the day becomes sharper, deeper, or more uncomfortable at night, especially when you're trying to sleep. Have you ever wondered why that happened? In this short video, I'll be explaining 4 reasons why this happens. Firstly, there's less distraction and more awareness. During the day, the brain is busy with movement, conversations, background noises, tasks, activities, all of which naturally dampens the pain perception. But in the night, the environment becomes quiet and still. The brain reduces its descending inhibitory pathways, the internal system that filters pain signals. So, the pain that was present all along simply becomes more noticeable. Not necessarily worse, just more clearly perceived. Secondly, increased blood flow and inflammatory mediators. When we rest, the body shifts into a recovery state. Blood flow to tissue increases to support their repair. But in cases where there's an already prepared inflammation, for example in arthritis, tendon irritation, or joint swelling, these additional blood flows deliver more inflammatory mediators to the area. These include prostaglandins, bradykinin, interleukin-1, 6, and tissue necrosis factors. These chemicals sensitize the nociceptors, which are the nerve endings that detect pain. As a result, the area becomes more reactive and pain feels more stronger at night. The third point is as a result of venous congestion and pressure buildup. When laying down at night, the venous return, which is the movement of blood back to the heart, slows slightly. In deep tissues or bone, this can lead to a buildup of internal pressure. Normally, bones and joint spaces do not expand easily, so even a small pressure increase can stimulate pain-sensitive structures, including the periosteum, the outer covering of the bone, which is highly innervated. This explains the deep, aching night pain often seen in bone infections and bone tumors. The fourth and last point I'll be talking about is the effect of cortisol and the body's circadian rhythm. Cortisol is the body's natural anti-inflammatory hormone, and it follows a daily rhythm. In the morning, cortisol levels are the lowest, and also in the night. So in conditions driven by inflammation, such as rheumatoid arthritis, inflammatory arthropathies, infection, or some tumors, pain and stiffness are naturally stronger overnight on waking up. This is why many people describe the morning as the hardest part of the day, because it's the point with the lowest natural anti-inflammatory hormones. So in summary, reduced distraction, increased sensitivity to pain signals, greater blood flows and inflammatory mediator delivery, pressure buildup in deep tissues and bone, and lower natural anti-inflammatory hormones level all contribute to pain feeling worse at night. For many people, this simply reflects the body's normal healing and inflammatory cycles. However, if the pain is severe, constant, wakes you up from sleep every night, or does not change with movement, especially if it's accompanied by fever, night sweats, or unexplained weight loss, please speak to a clinician. If you found this helpful, or you're interested in short clinical explainer videos, please don't forget to like, follow, and share with someone who might need it. Thank you for sticking around. Bye for now.